I am a holistic healthcare practitioner. I thrive. My job is to help you stay well. I do better in my career if I can teach you to recognize the signs of sickness and disease and dysfunction in your life and stay healthy, move through them, respond to them in a way that helps you thrive. And I do better when you thrive, when you are extremely strong, when you can pursue your dreams based on what I teach you and how I support you. I thrive. Right now, we live in an economy, a world or a national culture that has connected capitalism to healthcare. And the difference between a wellness practitioner, a holistic healthcare practitioner, and a mainstream doctor hospital practitioner is that doctors and hospitals make money off of sick people. When a doctor gets paid based on doing a surgery, the doctor needs a lot of people to need their surgery. Now, sure, they're going to make more money if they outcompete the guy in the next hospital. However, overall, both of them want a lot of people to need knee surgeries. And they'll make more money if they both do a decent job at it. And then their cousin and their friend needs it too. That's why we need single payer. I want you to think about how these forces work. In capitalism, the idea is that competition is going to produce the best results. That works in a proactive world when we're going for things that we want to be recreated. If I want an apple and I want the best apple, I'm going to gravitate to the farmer who gives me the best apple. And if someone sells me a bad apple, I'm probably not going to go back to him unless I don't have a choice. That's different with health. With health, we don't want 70 people to need knee surgeries. We want nobody to need knee surgeries. And if we need to have anyone who needs a knee surgery, we want it to be plausibly done without surgery. We want somebody who can help them fix it without the surgery. Knee surgeons want you to need knee surgery. They won't make money unless you do. So in order to make this model work, what we need is exactly what Bernie Sanders is advocating. We need a model of healthcare in which one entity pays everybody who do these jobs. If the government hires the people who staff a hospital, and those people all have food, they all know they have a salary, they all know that they're going home at the end of the day safe, then they're going to do the best job they can to keep you well. They want to do as little as possible to keep you well. They don't want to have to do surgery if they don't need to, because they won't get more money based on another surgery. They already have a salary. If they don't do a good job, you have to come back 10, 20 times. The whole hospital suffers and you won't keep your job. It's an entirely different capitalist model. And I want to encourage you to think about how this works. This is why we need single payer. And this is why it's completely false to think that capitalism produces the best results for healthcare. It doesn't. Capitalism encourages us to come up with as many gizmos and drugs and procedures as possible, because all of those gizmos and drugs and procedures make more money for somebody. And that's exactly what we've got. We have explosive healthcare costs that don't really resolve the problem. We have millions and millions of people who are getting sicker. How is it that the world is so much sicker? That people are sick constantly? That people are on 5? It's normal to be on 5 prescriptions. How is this what we've got? People make money this way. And every individual involved in the process might actually care. They might have gotten into their job. Let's just think that they got into their job in order to care. But overall, they exist in a system where they will make more money if you trust them, but you keep coming back because you need them. We have to change the system. We need all of these people to be hired within a structure that does better when you stay well. We need them to be working for a hospital who makes more money if you stay well. And that's only going to work if we have single payer. The government looks over it, pays that hospital, and those people who were hired will get fired if they don't do a good job. And the best job they can do is to never need you to go into the operating room.